My name is Jasmine. I'm a first-year student at Friends University studying zoo science. And today I'm going to take about 5 or 6 minutes to tell you about geriatric chimpanzees and how zoos take care of them. So how many of you have taken care of pets as they've started to grow older, you know? Yeah, a lot of you. So you know how sometimes you just got to change life up a little bit so you can make their lives easier. It's very similar to humans, you know. You have to change your day-to-day habits as you grow older because there's just some things you can't do as well. Especially when it comes to like highly physical things, it just becomes more difficult, so your life has to change. The same thing applies to primates and specifically chimpanzees. In both the wild and for chimpanzees in captivity, the average range of death age is from 32 to 35 years old. Once a chimpanzee lives past that range, they are considered geriatric or elderly. As the population of chimps in zoos and sanctuaries, grow older, zookeepers have to figure out the best way to take care of these animals, keep them healthy and happy throughout the rest of their years. Some big issues that come with geriatric care of chimpanzees are chronic diseases. So heart disease and sudden cardiac death are very common in chimpanzees, especially males. And along with those cardiovascular issues, they can get metabolic syndrome or renal disease, and those are just some more frequent chronic diseases that you might find in a chimpanzee. And of course, as they grow older, they become more and more higher risk for these diseases. So zookeepers and veterinarians, they have to work together in order to just find out the best combination of daily medication, for example, so they can help to prevent these sort of things from happening. But of course, that's not always a preventable thing. So they also have to try to figure out the best treatment plan for these animals if and when they do develop these issues. However, studying the risk of, chronic disease in elderly chimpanzees is not enough on its own to really figure out how to best care for them. So much like human beings, physical health is also a very important thing in an elderly chimpanzee's life. In 2007, there was a wild chimpanzee that scientists named Auntie Rose, who passed away at the ripe old age of 63 years old, and she was wild. She was known at that time as the oldest documented wild chimpanzee ever, because she hit 63 years old, and they do not typically live that long. It is believed that one of the main factors for her very long life was just the amount of physical activity she was able to have while she was living out in the wild. Research on both wild chimpanzees as well as those in sanctuaries show that better health in aging chimps is usually achieved by providing them with plenty of space to roam and stay active. Being able to stay active appears really to be the best way to keep their muscles from deteriorating as they grow older, just like in humans. It's like they say, either use it or you lose it. And that's very important, especially for all types of animals, but in this case, chimpanzees. In addition to this, there were studies done on chimpanzees in a research facility where when they separated geriatric chimpanzees from non-geriatric chimpanzees into two different groups, they found out that the geriatric chimpanzees were very inactive and their health was just declining rapidly, much faster than it was when they were all allowed to intermingle, because they believed intermingling the younger chimpanzees with the older chimpanzees would sort of stimulate that action that they needed to keep themselves healthy. Another big physical health issue that comes with aging is it's not as easily preventable as keeping them active. Inflammation of the joints is very common in elderly humans as well as elderly chimpanzees, along with dental and digestive problems. Obviously, when they have dental and digestive issues, They can't eat very well, they can't digest their food very well, which can cause immune system problems, which will make them more vulnerable to disease. However, even though this is not really something that can be prevented in all cases, it is typically treatable. So it seems that the most ideal living situation for elderly chimpanzees in captivity is to strike a balance between a natural habitat's abundance of space and capacity for physical action, and access to certain perks of captivity, like accessible health care and guaranteed food. The best of both worlds, as it were. But along with that, zookeepers must be ready to identify an animal's health issues and make modifications to that animal's environment when it comes to something like physical disability, especially when it comes with old age. So Sue Ellen is a 52-year-old chimpanzee who is housed at a Canadian chimpanzee sanctuary. She suddenly lost the use of her legs, and they had no idea what happened. They couldn't figure out an exact diagnosis for what happened to her, but she could not use her legs like a regular chimpanzee would be able to. And so to make up for this, her caretakers created a system of ropes and hanging apparatuses all around their sanctuary so that she could pull herself around and keep up with the rest of her troop. And by doing that, they actually helped her to regain her strength in her legs ever so slightly. And she's able to keep up with the rest of her troop because of these modifications that they made, which is a great example of any sort of adaptation that a zookeeper or any animal caretaker needs to make in order for their animals to thrive, especially as they grow older. Geriatric care of animals is a field of animal care that is constantly expanding and being researched as the population of animals in zoos continue to grow older. Everything that we know now about geriatric primate care is guaranteed to change in the future. And some of the preventative and therapeutic methods that we use now may be completely irrelevant in just like the next few years because we're just always learning about it. Quality of life plans that are made by zookeepers are like the most essential thing for these animals. And because not everything can be planned for, they always must have that capacity to adapt quickly to a situation